To the New York Times, Wisconsin is #3 on the list of states with a big COVID-19 problem.
For the better part of the past month, the state has reported around 2,500 new cases every day. Back on Live at 4 today to talk about that and other coronavirus-related news is UW Health's Chief Quality Officer, Dr. Jeff Pothof. Dr. Pothof, good to see you.
Good to see you too, guys.
Boy, being in the top 3 is not good news. Why are we such a hot spot right now?
You know, there's probably a couple different reasons. Some we can blame on college campuses. Maybe there's a component of kids back in school. But, what we know is that masking, hand washing, and distancing work. So if we're seeing an increase in cases, what that means is we're not doing that. That's the real reason that we're seeing an increase in cases.
And a lot of people thought that this was just an urban problem.
Yeah, so I think if you had watched the news earlier on in the pandemic, a lot of it was urban areas. They may have thought, this is a Madison problem, a Milwaukee problem, maybe a problem where there's college campuses, but that's not the story today. We're seeing COVID-19 increasing at alarming rates in some of our more rural areas of the state where maybe they didn't think this was something that was going to be personal for them.
Right, it's not Milwaukee and Madison anymore. It's especially bad in the northeast part of the state around the Green Bay area. Especially with hospitalizations. They're having a sudden surge in hospitalizations. Are we seeing a similar thing happening here?
So we are seeing an increase in hospitalizations. Now, what I heard from the hospitals up in that 41 corridor, the Fox Valleys, the Wisconsin Hospital Association is saying that they're getting close to reaching capacity. Here in Madison, we still have some room. We're still able to manage people in our special pathogens unit, but numbers are higher.
And do we see this increasing? Is this going to get worse?
Yeah, I think we really need to buckle down and try to flatten this curve. It sounds like, the motto from a few months ago, but it's as true today as it was back then. We got to get this curve flattened, or we could have bad things happening with people who need a hospital, not able to get the care that they should be getting because resources are so constrained.
Today at Governor Evers' DHS briefing, his COVID-19 briefing, Dr. Westergaard made a comment that if people think things are going to get any better soon, that is wishful thinking. That is, the weather gets colder and we all hole up inside, that things could get much worse. Do you agree with that?
Yeah, I wish I could disagree with Dr. Westergaard, but what he says is spot on. What we worry is that, instead of cold weather making us all isolate in our homes, that these gatherings that we know are spreading COVID-19 will go from outdoors to indoors, and that'll just make things worse.
How do you get the word across to folks that aren't going to wear a mask or wash their hands?
I think it's difficult. It certainly has been a challenge. In Wisconsin in particular, there's been a tremendous focus on personal responsibility as our strategy to combating this pandemic. And quite frankly, that's not working for us.
I think that's what's confusing and frustrating for a lot of people, is that a lot of steps that have been taken are not helping the situation. Most kids in the viewing area are going to school virtually, but it doesn't seem to be reducing the number of COVID cases in the community.
Yeah, I think the tricky thing with this virus is, it's not a matter of some of us doing this and others not doing it and then everything turning out okay. This is one of those things where we really need to be united. We all have to be in this together. And if we're not, we all go down together.
You're wearing a mask for other people just as much as you're wearing it for yourself.
Yeah, the preponderance of benefit is for that person who doesn't know they have the disease from spreading it to others. But there is also benefit in you wearing that mask so that you're less likely to get it from someone around you who is infected.
So you feel confident that if we all do the right things, if we all social distance and we all wear masks, the things we've been talking about for months and months, that we can get past this?
Yeah, I think if there's a silver lining, the data on mask wearing and social distancing is conclusive. It works. We struggle to do it in the United States, but in parts of the United States and certainly in other parts of the world, they've shown us beyond a shadow of a doubt that this works. We can flatten the curve if we do these things.
We could all use a silver lining at this point.
There you have it.
Doctor, thanks for being with us again. We'll see you soon. I guess you're going on vacation? You're off for a couple days?
Yeah, we'll see how that works. I'll come back and see what happened to the state, right?
Well deserved.
You deserve a break.
Yes, well deserved, Dr. Pothof. Have a great trip, and we'll see you very soon. Thanks so much for your time.
You guys have a good afternoon.